Good evening to all dear friends. I am Saurabh Sharma, member team Pharma Lok. Today I organize a Pharma ki PATHSHALA on the topic of role of gut microbiota symbiotics in inflammatory bowel disease with our eminent speaker, Dr. Neeraj Mishra sir, Professor, AMITY Institute of Pharmacy, AMITY University, Gwalior. Before starting the session, I briefly डिस्कस अवर सर का बायोडाटा हम डिस्कस करेंगे ब्रीफली और बताएंगे सर ने किस तरह से फार्मेसी की फील्ड में एक अपनी अलग पहचान बनाई है, एक रिसर्च स्कॉलर की तरह, एक रिसर्चर की तरह और एक अच्छे टीचर की तरह सर ने अपने आप को इस फील्ड में कैसे स्थापित करा है. तो बिफोर स्टार्टिंग द सेशन आई ब्रीफली इंट्रोड्यूस सर. डॉक्टर नीरज मिश्रा सर has working as a professor in AMITY Institute of Pharmacy, Gwalior since July 2019. He had around 20 years of teaching and research experience. He had recipient of ICMR SRF, New Delhi, India. He worked as a brand ambassador of Bentham Science, USA 2018-19. He has guided 30 MPharm students and guided one PhD student. He has more than 100 publications of international and national reputed in journals in recent concept of novel drug delivery systems, oral delivery and symbiotics, localized drug delivery system, targeted and controlled drug delivery system, nanocarriers, microparticles for the treatment of breast, colon cancers and neurodegenerative disorders. Dr. Mishra has more than 1,300 citations with H index of 30. The total paper is more than 300 as per his scopus. He has also written more than 10 books, 25 book chapters in Elsevier, Bentham, Springer, Villi publication. He has also been granted 3 international patents and 2 Indian patents. There is a more such a journey of the Dr. Neeraj Mishra sir. तो सर ने इतने कम समय में इतना सब कुछ अचीव कर लिया, ये डेफिनेटली सर का हार्ड वर्क और सर का डेडिकेशन है प्रोफेशन के प्रति, अपने काम के प्रति. तो आज उसी कड़ी में आज जो फार्मा की पाठशाला हम लोग डिस्कस करने जा रहे हैं आप व्यूअर के साथ में, तो हमारा यही उद्देश्य है, हमारा यही एक टास्क है कि सभी लोग जाने कि एक्चुअली में माइक्रोबायोटा बायोलॉजिकल जो हमारा अंदर गट फ्लोरा होता है वो किस तरीके से हमारी ह्यूमन हेल्थ को इफेक्ट करता है. क्योंकि ऐसा बोला जाता है अगर आपका गट फ्लोरा ही डिस्टर्ब है तो डेफिनेटली आप कोई सी भी मेडिसिन आपको असर नहीं करेगी, आपको डेफिनेटली बीमारियां घेरे रहेंगी. तो उसको हम कैसे अच्छा रख पाए और उससे कौन से रिलेटेड जो डिसीज है उनको कैसे दूर किया जाए और इन्फ्लामेटरी जो बोवल डिसीज होती है उससे कैसे बचा जाए, तो उसके बारे में सर से आज हम डिस्कशन करने वाले हैं. तो ओवर टू यू सर. आपको मैं देता हूं मंच सर, आप स्टार्ट करिए सर.
Thank you, Saurabh, for introducing me. Today, as I told by Saurabh, today I will discuss the role of gut microbiota, synbiotics in inflammatory bowel disease. First of all, what is gut microbiota? Gut microbiota comprise of the good bacteria, which are called the probiotics. So they play important role in the building of the immunity of the body. About 90% of immunity reside in the intestine. Intestine comprise of the good bacteria, and these good bacteria they also called the commensal bacteria, which plays important role in our protection from the pathogens and other pathogenic microorganisms from the body. So first we'll start with the IBD, inflammatory bowel disease. It's comprised of the Crohn's disease and the ulcerative colitis, which is a significant burden in the human health. Nowadays, IBD become common in the India. Previously, it was more prevalent in the foreign countries. Yeah, these diseases occur because of the junk food. If we're taking junk food like burger, pizza, momos, they deplete our mucin layer, which in the stomach also in the entire GIT also. Entire GIT length around 4 to 5 meters. So when the GIT layer get depleted, it will lead to the ulcer in the GI and the colon and the GIT that will cause the disease that is called the Crohn's disease and the ulcerative colitis. So this inflammatory bowel disease, why it is called IBD? Because in the disease, the ulceration or the inflammation takes place. Inflammation takes place when increase of the ROS, reactive oxygen species. There's ROS. When the ROS increase in the body, that will lead to the IBD, and that can disturb the gut microbiota. So gut microbiota, so that is this disturbance that is called the dysbiosis. So dysbiosis may lead to the disease, IBD. So alteration you see in the two figure. In colitis, ulcerative colitis, mainly the colon part get inflamed, inflammation take place. But in case of the Crohn disease, the colon and the GIT level, duodenum and the GGM level, that is called, that will get inflamed. So IBD is a inflammatory and autoimmune condition that affected the, see the this healthy colon, this is the Crohn disease and the colitis. So see the, it will inflame the colon and the intestine. This is inflammation of the colon. So that may lead to the severe abdominal pain, weight loss, vomiting, and diarrhea. So that's why it is preferred by doctors. We should take some fibrous food. We should take the food which is comprised of fibers. Fruits also is recommended, because food and fruits and fibers, they will help in the digestion also. They help with the immunity also, and it affect the all layer of the ball. It will affect the mucin layer, and that will lead to formation of the granuloma, that is called the accumulation of the RBC in the patient. It may affect the superficial mucosal layer. What happened? Our GIT is and stomach also covered by the mucin layer. What have the mucin is a protective layer which prevents the infiltration of the pathogens inside the colon and the stomach also. In case of the depletion of the mucin layer, that may leads to the infiltration of the bacteria pathogens, so that may cause a severe disease. That's why I told you in the earlier starting also, we should take the fibrous food and the millets also, so that we can improve our digestion. And fibrous food, I told you all in later I will tell you, they comprise of the prebiotics. So our GI gut microbiota, starting from the stomach, duodenum, small intestine, and the colon. Largest amount of the bacteria, good bacteria, they call the probiotics. They are called the bactericide, E. coli, bifidobacteria. There's so many bacteria are there. They are called the highest count colony, 10 is for 10 to 12 colony forming unit per ml in the colon. So colon, what happened when you take the mm, water in infected water, that will lead to diarrhea. So diarrhea may lead to dysbiosis or disbalance the good bacteria in the colon. Same type in the stomach also, least probiotics are there, 10 to 1, 10 to 2 per CFE per ml, Helicobacter and the Streptococcus. The jejunum and ileum also 10 to 4, 10 to 8 CFU. It's called the bacteriocytes. And the Streptococcus, lactobacillus, we should take curds. Curd comprise of the lactobacillus, bifidobacteria, and fusobacteria. So these probiotics, they build up the immunity, and they have the protection power. They are antioxidants. They reduce the stress, and that stress may prevent from the ulceration or the inflammation. So these are that we can say chart that will give the idea again how the gut microbiota in human health and symbiosis both are equally affected. If we take the human, and if we provide the nutrients and shelter, that may increase the gut microbiome, increase the microbiome, and this microbiome increase the metabolic capacity of the host digest plant carbohydrate. It will have the digestion of the carbohydrate, milk products, and provide the provide vitamins like B2, B12, K, and folic acid, and protect the colonization with pathogenic bacteria. So this also helps from the, if we take the probiotic daily and probiotic containing food, prebiotics, that will definitely boost our immunity and boost our health also, because we are symbiotic means both are dependent. So good bacteria, they're also called the commensal bacteria, and we can with the nutrient cell I have told you. From what is impacting factor of gut
Uh,
microbiome?
Excuse me, sir. Uh,
Yes, yes,
yes, sir. I disturbed to you, sir. There is
yes.
any option showing in your screen that presentation option is there present on the screen, sir?
Actually, I told you earlier also
Okay.
how to show. I'm unable to display on the
Okay.
side. Is there an
Okay,
option
sir.
in the slides are not visible there?
Yes, sir. If any possibility that slides are visible, sir, if any option is present on your screen, sir, please
Actually,
active
two
that
options
option.
there: mute, stop, setting, present.
Present. Yes, sir. Present option is there.
Okay, slides are showing.
No, sir.
I think it's uploading. Just wait.
Okay.
This processing. I think.
Okay.
Yeah, I think it's showing. Huh?
Yes, sir. Visible.
Yeah,
Yes, sir. Okay.
yeah. So, shall I start from starting or shall I go ahead, move ahead?
As per you, sir.
Okay, okay. So, this I have told this is a ulcerative colitis. This is a Crohn disease. You see the colonic part here in case of colitis and entire GI inflammation in case of the Crohn disease. This I have told you also. This is I have told you regarding the how the colon comprise of the 10 is to 10 to 10 is to 12 called CFU, that is colony forming unit per ml. Per ml. So these are numbers of bacteria reside in the colon, and after the colon, there's a jejunum and ileum, 10 is to 4, 10 is to 8 probiotics are there, least in the stomach. So these probiotics, what they do? They build up the immunity and protect our body also from the pathogen foreign invasion and helps the immunity. They reduce the ROS. ROS that is called the reactive oxygen species. This I've told you. This is how the microbiome help. How the microbiome helps. They provide the vitamins. They reduce the ROS. They help in the digestion also. So digestion also they help. Impact factor on the gut microbiome. If we take the good diet, fibrous diet, definitely it will induce the increase the gut microbiota, because the if we take the more amount of pharmaceutical medicine, that may also lead to adverse effect on the gut microbiota. So doctor, that's why doctor also prescribe not to take the antibiotics for more than 3 to 5 days, because these antibiotics will take the longer time, that will disturb the gut microbiome. That dysbiosis may lead to the inflammation and increase the ROS. Stress also. It is observed that person saying I'm diabetic, I'm not taking any sugar, but stress also. If stress leads to increase of the ROS, that will lead to the diabetes also and several disorder. Stress is a root cause of all the disease. So some lifestyle change also going to affect the IBD. And what is symbiotic means? Symbiotic comprise of the prebiotic and the probiotic. So prebiotic they are called the digestive part of the vegetables, which these are the called the prebiotic, and probiotic they are called the living microorganism. So when the probiotic and prebiotic combines, they are called the symbiotics. So prebiotic we can also get from the fruits, fibers, and also get from the polymer like inulin in our MapCos project that we are still working. So we have used the inulin polymer which act as a prebiotic. So what prebiotic do? Prebiotic increase the action of the probiotic. So this probiotic increase the short chain fatty acid, they decrease the uh, fecal pH, they reduce the inflammatory markers, they reduce the severity score, they reduce the pain also. That's why the probiotics and prebiotic is that's the mixture that is called the synbiotics. Now tell about the what is probiotic. The root word of probiotics comes from the Greek word pro, meaning promoting, and biotic means life. They are life promoter, we can say, and they are called the living microorganism. You've heard about Yakult, right? Yakult is a mixture of probiotic. So with probiotic, they are called living microorganism, and which helps in the digestion, build up the immunity. Food and Agriculture Organization of United Nations (FAO) define probiotic as a live microorganism which, when administered in an adequate amount, produce beneficial effect to the host. When they're taken orally, they produce the beneficial effect means they build up the immunity that is very important for the body. If you take the regular amount of Yakult and other probiotic sachet, they are seen in this Progard, so this tablets also that will helps in they are probiotic supplements which we can get if we're not taking that good fibrous vegetable all the time. We're not taking the vegetables fibrous vegetable all the time. Then we can take the Yakult also, and the other supplements also we can get. We can get the probiotics. Probiotic they chelate the metalines, they produce the antioxidants metabolites. So probiotic what's to do? They produce the antioxidant metabolites. They upregulate antioxidant activity of the host. They increase the antioxidant level and they downregulate the activity of the enzyme. Enzyme which produce the ROS. ROS I told you, reactive oxygen species. So ROS will increase the inflammation. These probiotics reduce the inflammation, which is the main cause of IBD. IBD, inflammation, inflammatory bowel disease. Inflammation disturb the bowel movements. So how this probiotic work? Prebiotic, we can say they are the dietary prebiotic is selectively fermented ingredients, means they can get from they are dietary fibers with a well-established positive impact on the intestinal microflora. If you take the dietary fibers, definitely they're going to affect the intestinal microflora. They are the undigested oligosaccharides or the inulin polysaccharides, which will help the so probiotic going to increase the action of the probiotic. Provide example told you lactobacillus plantarum and the bifidobacterium VSL mixture of the prebiotic that is called the inulin and the fructooligosaccharides. They are the example of the pro and prebiotics. One term also going to find that is called the postbiotic. One often questions arise how the probiotic works. Probiotic works by forming its metabolites. Metabolites, what metabolites are? They are called the short chain fatty acid, pyruvate, bacteria. They are the metabolite of the probiotic. These metabolites they are called the postbiotics. Postbiotics are nothing but they are metabolite product of the probiotic, which helps reducing of the ROS, increase the catalase activity, which can build up the reduce the inflammatory markers. This strategy how the probiotic action in the IBD. If you take the probiotics, they downregulate the formation of the interleukins, and prebiotic also going to support the mucin. The probiotic also going to give the thickening. Build up the mucin layer. So this mucin layer will prevent the infiltration of the bacteria virus, and so that's improve the gut health. So see that here the probiotic how they suppress the activation of ROS and improving the process of the IBD. So they can cause the inflammation and they can reduce inflammation by the probiotic. So probiotic and prebiotic they work together. Probiotic and prebiotic they work together and thickening of the mucin layer and they down regulate the inflammatory markers like IL-6, IF, and gamma. So these markers they increase the ROS. So by doing this, we can say probiotics suppress the ROS and increase the bacteria and catalase activities. How this I told you also they are called. If you take the fiber rich diet that is comprised of this is dietary fiber that is called the prebiotic. So these prebiotics will go into the gut microbiota and increase the short chain fatty acid. These short chain fatty acid will reduce the ROS and increase the catalase activities, which can which can down regulate the inflammation of the GIT. So these are the metabolites of they are called the postbiotic. Bacterate, pyruvate, they are called metabolites of the probiotics, which will play the not only the intestinal inflammation, they also going to affect the brain disorder also. So by the gut-brain axis, so this probiotic, I'm writing several books. I will tell you later on how the probiotic going to affect the uro disorder also. What are treatments in case of the IBD? We can yes, modify the oral microbiota. By modifying the oral microbiota, we can treatment of the IBD we can do by diet nutrient therapy. If we take the specific diet rich with the specific carbohydrate diets, fibrous diet, so that definitely we can improve the treatment of the IBD by the fecal microbiota transplantation (FMT). This also technique we can the FMT technique we can treatment that can be used. Some anti-inflammatory anti TNF alpha kinase inhibitor, TNF alpha inhibitor, which can produce inflammation that can be used for treatment of the IBD. Drugs also using fecal microbiota modification of oral microbiota we can use. Initially, the from mild case we can use the antibiotics. Moderate case we can use the corticosteroids. Severe condition we can use the biologics, and the biological means that they are called the monoclonal antibody which can be used. Severe condition we can use the condition we can use surgery. These are the drugs that can be used for the UC and IBD. We can use the so many drugs are there. Azathioprine, this is called the tocilizumab, and project I'm using. We can use the other drug also, sulfasalazine. We can also use. Too many drugs are there. That is called the Chinese conservative drug. That is called the tocilizumab. We can use for treatment of the IBD. Yeah, fecal microbiota transplantation is a known technique for the, also called the stool transplantation, administration of the fecal matter from the donor to the intestinal tract of the recipient. So by transferring of the fecal matter from the donor to recipient cell, we can improve the that microbiota of the patient in the case of the IBD. So with the FMT, we can improve the count of the good bacteria in the colic region that will benefit for the health. Conclusion we can say probiotic bacteria and fungi, they modulate the pro-inflammatory and the anti-inflammatory pathways, which can prevent the ROS and increase the catalase activity and SOD, that is called super dioxide. Probiotic and prebiotic, they work together. They decrease the ROS, increase the SOD, super dioxide, and the catalase activity, which can reduce the inflammation in case of IBD. Synbiotic and prebiotic, they definitely have a great potential for future therapeutic approach in case of IBD. Prebiotic, they are called dietary fibers. They improve the mucus immune function. They improve the mucus immune function and mucus secretions and prevention of disease. Dietary fibers, they increase the short chain fatty acid. Short chain fatty acid, they cross the mucosa, means they cross the intestine and regulate the intestine immunity and pass into circulation to modulate the metabolic and the immune function. As I told that the immunity reside in the intestine. Why? Because of the probiotic. These are the metabolite short chain fatty acid. It is a metabolic product of the probiotic. This is called the postbiotic. They go into the mucosa and regulate the immune function and also regulate the metabolic disorder like the diabetes and neuro disorder like Huntington disease, Parkinson's disease can be also activated by the the pro and prebiotic. These are some I got award also and got in the IPGA and the recognition award from the and the serve in the 2019. These are published book in the symbiotic in the symbiotic in the management of the cancer, and these are the symbiotics in the human health. We are my team that we work. This is the major reference book. This is a microbiota gut-brain access. This is Elsevier book. This is the IBD book I've written with the help of the so my colleagues are there. Sumail and Assis, we write in this book in the CRC press. So this book in the pipeline. This is again we writing with the Sumail and the Assis symbiotic in the metabolic disorders. These are some patents. Thank you. Any question?
Okay. Wonderful session, sir. Thank you, sir, for giving us such a briefly information relating prebiotic, probiotic, symbiotic, and IBS. I think, sir, a daily intake of 3 to 5 gram of prebiotics is required for the healthy health. Okay, also a information related to this pre and probiotics, that 1 kg to 1.5 kg, they are the healthy flora present in a gut of in a healthy human. सो देयर इज ए इम्पोर्टेंट एस्पेक्ट सर, क्योंकि हम इसके बारे में इतना कुछ नहीं जान पाते, और जितना आपने बताया सर, डेफिनेटली अगर हम इस चीज को मेंटेन रखें तो डेफिनेटली जितना एंटी हमें बायोटिक्स के ऊपर डिपेंडेंसी है उसको हम कहीं ना कहीं अपने आप कम कर पाए। और जैसा आपने आईबीएस इन्फ्लामेटरी बाउल डिसीज के बारे में बताया कि इतनी सब प्रॉब्लम्स है, और उसमें आपने एक नया जो थेरेपी के बारे में बताया जिसमें हम फेकल माइक्रोबायोटा ट्रांसफ्यूजन करते हैं, तो वो अपने आप में एक बहुत अच्छी नोवल अप्रोचेस है, नोवल थेरेपी की अप्रोचेस है जिनको यूज करके हम बगैर किसी फॉरेन या केमिकल या इस तरीके की थेरेपी के दिए बगैर ही पेशेंट को नेचुरल तरीके से इजीली ट्रीट कर सकते हैं। तो सर, बहुत ही बढ़िया सेशन आपके द्वारा ये हमारे व्यूअर्स के लिए, फार्मा लोग के व्यूअर्स के लिए, और डेफिनेटली फार्मा की पाठशाला में हमारा जो प्रयास है न्यू स्टूडेंट्स को लेकर, न्यू प्रोफेशनल फार्मेसी से जुड़े हुए प्रोफेशनल्स को लेकर, कि हम इस तरीके की जो एपिसोड्स हैं उसके थ्रू हम हमारे व्यूअर्स को, स्टूडेंट्स को, हमारे प्रोफेशनल से जुड़े लोगों को नए नए टॉपिक्स पर, नए नए जो अलग अलग नए एडवांसमेंट होते जा रहे हैं, टेक्निक्स आ रही हैं, तेजी से जो बदलाव आ रहा है उसके साथ उनको इन्फॉर्मेशन हम प्रोवाइड कर पाएँ और उनको अपडेट कर पाएँ करंट स्थिति में जो चल रहा है उसके साथ। क्योंकि डेफिनेटली ये जो करंट टाइम इज ए इंफॉर्मेशन एंड टेक्नोलॉजी टाइम जैसा बोला जाता है कि उसका युग है, तो उसमें हम उसको जोड़ पाएँ। तो एक सर मेरा क्वेश्चन ये है आपसे सर, कि
Yes, yes.
अगर एक हेल्दी ह्यूमन है और उसका अगर ये जो माइक्रोबायोटा डिस्टर्ब चल रहा है, तो डेफिनेटली उसको सो मच लाइफस्टाइल डिसीज, जैसा कि आपने बताया सेशन में, कि डायबिटीज है, कार्डियोवास्कुलर डिसीज है, कोलोनिक कैंसर है, तो उनसे वो कैसे उसको डेली लाइफ में अपने ये चेंज करके और उसको वापस से रिटेन करके वो हेल्दियर रह सकता है सर, प्लीज सर।
Yeah, if the person suffering from the dysbiosis, how we can improve the. So you can't simply take the medicine all the time. But what happen if you take the, like, the natural source of probiotic? If you take the dietary fibers, like the fibrous food, fibrous diet, so these fibrous diets which rich of the prebiotics. So when the prebiotic go inside the body, they will stimulate the probiotics. So means they are act as a stimulator, catalyst. So these probiotic act act as a metabolites. Metabolites कैसे बनेंगे? Short chain fatty acid, bacterioate, pyruvate. They cross the mucin layer, go into the blood and improve the, cross the mucin layer and go into the blood circulation and improve the immune function. Immune function से क्या होगा? They will make the protective mucin layer. So if the mucin layer protected, and definitely going to we can get healthy. And I told you one thing also very importantly. What happen if we take the antibiotics? So I do not rely on the, and if we take the much more want antibiotics, so antibiotics may lead to the MDR. There's multi-drug resistance. So this MDR is not good for the, because we have to take more drug, and drug itself having some side effects. So this probiotic is devoid of side effects, and definitely going to boost the immunity also, because in the, we are living in the, previously we are suffering from the COVID all the time. So this probiotic definitely is going to help the, from the build up the immunity. And I told you also from the brain, proper function of brain also is important. We should take the fibrous diet for the good, because neuro disorder also by the probiotic connected with the brain by the gut brain axis. I can share my full copy of books also to, you can circulate to the your team also. So I'm working since 2016. So my student Nidhi, she started the work on the, I gave the work to Nidhi and Vandana regarding the how probiotics and the working on the ulcerative colitis. So very good. We can work a lot. We can use the combination of probiotic with the drug also. So probiotic plays important role in the body, starting from not only from the IBD, for other disease also, like we can say stress or the diabetes disease, diabetes and the brain disorder like Parkinson or Alzheimer, like this.
Okay, sir. Thank you, sir, giving us such information related to pre and pro and how to use this concept in your daily life, and we make healthy and prosperous life all the way. Thank you, sir. So I conclude this session. Sir has giving us such wonderful insight regarding prebiotic, probiotic, symbiotic, and IBS. So, sir, thank you for coming in the platform of Pharma Lok Pathshala. I थैंकफुल फॉर माय होल टीम, और हम आशा करेंगे कि आप नेक्स्ट टाइम और अच्छे इंफॉर्मेटिव सेशन में हमारे लिए नए नए इस तरीके के टॉपिक लेके आए, जिससे व्यूअर में एक नई इंफॉर्मेशन मिले और उनका जुड़ाव भी अपनी हेल्थ को लेकर भी हमेशा वो अवेयर रहे, क्योंकि आजकल हर कोई जो चाहता है वो चाहता है कि मैं हेल्दी रहूं, वेल्दी रहूं, फिट रहूं, फाइन रहूं। तो इस तरीके के इन्फॉर्मेशन सर आप जरूर लेके आइए, और फार्मा लोग की पूरी टीम की तरफ से मैं सौरभ शर्मा आपको बहुत सर धन्यवाद चाहता हूँ और आपसे आशीर्वाद चाहता हूँ कि आप इस तरीके का हमारे सेशन में आते हैं।
Sure, sir. Thank you.
ठीक, थैंक यू सर।